Hey class, it's Haleigh Dunning.
And this is Jaleesa, and today we are going to talk to you guys a little bit about breastfeeding. So we're probably just going to dive right into the presentation, but first, breastfeeding is defined as a baby feeding from the mother's breast. So the baby is getting human milk. Inclusion really limit breastfeeding mothers because instead of just being able to freely breastfeed, they have to kind of search for places to express their milk or to actually feed. So places like the workplace really limits women. There are designated rooms that women have to seek in order to pump their milk. And also in public spaces, stigma towards women who breastfeed in public, and it's kind of over sexualized. And a lot of this negative imagery of women breastfeeding comes from the media. The media influences the way women hide when they breastfeed or feel like they have to be covered up or they can't be seen in public breastfeeding. A lot of that came from like the Western culture that kind of painted the picture that breastfeeding was inconvenient or inappropriate to do in the public. It should kind of be done at home. In the image, there is a woman who is running a marathon, and she paints another picture that it's not inappropriate and it's a natural thing for women to do. The next component that we will be focusing on are social inequities, socioeconomic status. We decided to really do a lot of research on this particular component because we know that socioeconomic status often reveals inequities. Poverty, being a component of socioeconomic status, really hinders women from breastfeeding. So, as you can see in the image, families who make less than $22,000 a year only have a 38% breastfeeding rate, whereas families who make more than $134,000 a year, they breastfeed at a rate of 68%, which is, it's kind of doubled of what lower income families do. And there are a lot of things that really go into this, like people in lower statuses, do they lack the education they need to breastfeed? Are they getting lactation appointments? Are they having difficulties with their babies latching? Breastfeeding is healthier for your baby. And we can't count out transportation issues, like people in lower income neighborhoods, do they have cars? And if they don't have cars, do they have transportation to those lactation classes or to those parenting classes? The resources that people in lower classes may face, such as if they live in a food desert, is the food that they're eating really nutritious enough for the mother to pass to the baby? There is no barrier between a mom and her breast milk to a baby. So, if a mother lives in a neighborhood where convenience stores that sell fried foods where she lives, is her breast milk really more nutritious than formula? Those are some examples of things that we have to keep in mind when we think about social inequities. And then we also looked at the support women and families in different classes have. There's been research that shows that hospitals in America that are not baby friendly. So their first push for a woman is not specifically breastfeeding. And then marital status also dictates breastfeeding rates. So married women, they breastfeed at a rate of 60%, whereas women who are never married breastfeed at a rate of 29%. So ways to reduce inequalities, we want to improve hospital maternity care. So, we want to make sure that women know that they have the right to tell nurses that they don't want their baby to have a pacifier until it appropriately latches on. Lactation support groups, peer support groups. We want to boost breastfeeding support in the workplace and show that breastfeeding is not inconvenient. It's a natural thing. Where we see a lot of discrimination towards breastfeeding mothers is in the workplace. So women, they don't have time to express or pump milk, and their paid leaves are not enough to sufficiently support their families, as well as, getting hired with a baby is harder for some women. A lot of women know that you can't walk into an interview pregnant because 9 times out of 10 you probably won't get the job. In hospital and medical settings, like the opinions or forcing one act on a woman kind of goes back to the baby friend. Are women actually getting the support they need to make a good decision for she or her baby, or is she just being forced to bottle feed her baby? And then also discrimination within the public, just hearing rude comments that could offend a pregnant mom, or just a mom being uncomfortable to expose herself to breastfeed, all kind of ties into discrimination. Social determinants of breastfeeding, economic stability. Are women, do they have the resources to economically support their babies, or to support breastfeeding? That also goes back into like the workplace. Can a woman take enough leave off to breastfeed her child for 6 months, which is recommended by the World Health Organization? Built neighborhoods, built environments. Like, is a woman, does she live in the food desert? Does she have access to nutritious foods? And just how does the community view breastfeeding? Is it negatively viewed, and does it make a woman not want to breastfeed in public? And then healthcare, or access to healthcare and health, as well as health behaviors. Once again, is a woman eating the way that she should be eating when it comes to feeding her baby? And then the conditions of her neighborhood. Do these really encourage breastfeeding? And then the social and community context, how much does the influence breastfeeding? And of course, education. Socially, does a woman know that she has access to lactation education? And what are the misconceptions of breastfeeding? Like, many people think that breastfeeding causes your breast to sag, or it causes extreme bodily changes, or do they think that formula is just easier? And, all of this is ultimately up to the mother to decide whether she will breastfeed or not.
Health literacy also contributes to the decision. Is every population given truly accessible opportunities? For example, are cultural components being acknowledged when educating to mothers? UNICEF released a report that noted in 2007 less than 3% of United States births occurred at baby-friendly facilities, and those numbers have increased 25% of births since 2018. However, this means that there is still work to be done. More baby-friendly facilities can assure that assumptions are no longer being made, and it can also ensure that the correct language can be determined appropriately. As you see in the image, language barriers can be observed everywhere. From confusing depictions of ratios, numerical data, poor choice of colors, and also the language that the material is in. Is it being portrayed in English, Spanish, any other languages that would be appropriate for populations in United States areas? In relation to breastfeeding, cultural stigmas towards it have evolved over time. It was originally very common and popular amongst Egyptians, Romans, and Greeks, and eventually it was adapted by royalty. The usage of wet nurses became a big hit after royal times, when queens began using wet nurses, women hired to feed royal babies breast milk. Breastfeeding then became negatively portrayed in the late 1800s to the 1960s. Western culture ruined the image of breastfeeding by saying that only undereducated and poor women breastfed. This imagery that Western culture portrayed added to the causes of disparities in breastfeeding in the United States. The push for welfare in minority communities created a new problem, ruined the ideas of breastfeeding for many minority women as they were offered more readily free formula for their babies. You can see there is a great difference of different ethnicities and breastfeeding rates amongst them. Asians have 70% of mothers who breastfeed for 6 months. Black have only 36%. These issues can be seen on a national scale as well. This image shows how great of a national problem it is, as the majority of our states throughout our country do not meet the Healthy People 2020 goals. Then here you can see that our West Coast has higher percentages of breastfeeding rate in the high 90s, and the more eastern and poorer states in the U.S. have lower, somewhere around 50%, 61 and 59% rates of breastfeeding in meeting these goals. This other image illustrates the differences in urban and rural areas with the same concept of wealthier states and breastfeeding rates. For overcoming inequity in breastfeeding, there are many programs locally and nationally that are trying to accommodate for mothers all over. Girls Incorporated and Impact are peer-to-peer education groups that increase awareness of the benefits of breastfeeding to young women. And baby-friendly facilities, such as NOLA Baby Cafe, are becoming more popularized, and they encourage the idea that breast is best. That will conclude our presentation for today, and we hope we shared some knowledgeable information with y'all. And thank you for your time.